All right, today we're talking about Ramipril. It's this tiny little pill, right? But millions, and I mean millions of people all over the world count on it every single day. And what's it doing? It's protecting their most vital organ, the heart.
This isn't just some niche drug. It's a true cornerstone of heart health therapy. Doctors prescribe it for all sorts of things, from high blood pressure to heart failure. Its impact on public health, it's just massive.
So that's the real question, isn't it? How does it pull this off? Because it's not as simple as just lowering a number on a blood pressure machine. No, there's a really precise, really powerful mechanism going on deep inside your body.
So, let's get into it. Let's really break down how this one little pill can have such a huge effect. We'll start with the basics. What is it, exactly? Okay, so Ramipril is part of a family of drugs called ACE inhibitors. Now, that's a bit of a mouthful, but it stands for Angiotensin-Converting Enzyme Inhibitor. And trust me, that name is the key to understanding everything it does. But you know, before it can even do its job, something really interesting has to happen first.
See, Ramipril itself, it's actually what's called a prodrug. The best way to think about it is like a secret agent in disguise. When you swallow that pill, it's totally inactive. It's just laying low. It travels to your liver, and that's where the magic happens. The liver converts it into its active, super powerful form called ramiprilat. And ramiprilat, that's the molecule that actually gets the job done.
So to get how Ramipril works its magic, we first have to talk about the system it's designed to hack. It's called the renin-angiotensin-aldosterone system, or, RAS for short. Now, this is your body's own natural, built-in system for keeping your blood pressure and fluid levels in check.
The easiest way to picture it is like a chain reaction, a domino effect. Step 1, the liver sends out a protein. This then gets converted into something kind of weak called angiotensin I. But then comes the really critical step. An enzyme called ACE, that's our angiotensin-converting enzyme, comes along and transforms it into the super potent angiotensin II. And you can think of angiotensin II as the villain in this whole story. It's a master constrictor. It powerfully squeezes and narrows your blood vessels, and that just skyrockets your blood pressure. But that's not all. It also sends a message to your kidneys telling them to hang on to more salt and water, which increases the total amount of blood you have. And over the long haul, it causes this harmful thickening of the heart and vessel walls, making everything stiff and way less efficient. It's bad news all around.
Okay, so if angiotensin II is the big problem, then how exactly does Ramipril fix it? Well, this is where its really elegant and precise action comes into play. It's pretty clever.
Ramipril's mission, it's actually incredibly simple, but it is so effective. It looks at that chain reaction we just talked about, and it breaks the single most important link.
Okay, so here's that same pathway again, but now let's see what happens with Ramipril on the scene. Remember our secret agent, Ramipril? It jumps right in and completely blocks that ACE enzyme. It basically puts it out of business. And by taking ACE out of the picture, it stops the body from making our villain, angiotensin II. Just like that, the chain is broken.
The results? They're totally transformative. Before Ramipril, you've got that villain, angiotensin II, running around causing all sorts of trouble. But after Ramipril, with that villain completely blocked, everything changes. Your blood vessels relax and open up, your kidneys let go of all that extra salt and water, and the strain on your heart is just massively reduced.
But wait, here's where it gets even cooler. The benefits here go way beyond just lowering a number on the blood pressure monitor. By putting a stop to angiotensin II, Ramipril basically acts like a protective shield for your most important organs. And that's exactly why it's used for so much more than just high blood pressure. It's a go-to for managing heart failure, for improving survival rates after a heart attack, and, this is a big one, for reducing the risk of another heart attack or stroke down the line. It even plays a huge role in protecting the kidneys, slowing down disease, especially for people with diabetes. And look, this isn't just a hunch. The protective effects of Ramipril are backed by huge, major clinical trials. We know that a specific dose, 10 milligrams a day, has been proven to slash the risk of heart attack, stroke, and even death from heart disease in people who are at high risk. So this isn't just theory, It's a life-saving intervention, and we've got the evidence to prove it.
Of course, with any medication this powerful, using it safely is key. And that means we have to talk about the potential side effects. Let's start with the one you've probably heard about.
Yeah, the most famous side effect is definitely that dry, annoying, persistent cough. You might wonder why that happens. Well, when Ramipril blocks the ACE enzyme, It also lets another substance, called bradykinin, build up in the lungs, and that stuff can be irritating. Now, while it can affect up to 1 in 5 people, it's really important to remember that for the vast majority, we're talking over 80% of people, this is a complete non-issue. Some other common side effects you might see, especially when you're just starting out or maybe when your doctor ups the dose, are all related to the fact that it's lowering your blood pressure. So you might feel a little dizzy or lightheaded, maybe get a headache, feel tired. Some people even get a bit of nausea. The good news is this stuff usually gets better as your body gets used to the medicine.
Okay, now we need to switch gears a bit and talk about the more serious warnings. Look, these are rare, but it is absolutely critical that you know about that.
The most urgent one is something called angioedema. This isn't subtle. It's a rapid, severe swelling, usually around the face, the lips, the throat. And this is dangerous because it can actually block your airway. It's a full-blown, life-threatening medical emergency. So, if you or someone you know experiences any swelling like this while on this medication, you need to get medical help immediately. No hesitation.
Ramipril also has the FDA's most serious type of warning, what's called a black box warning, and it's about pregnancy. Let me be perfectly clear. This drug is absolutely contraindicated. It must not be used during pregnancy, at any stage. It can cause serious injury or even death to a developing baby. So if you're taking this medication, effective contraception is absolutely essential.
You also have to be really careful about interactions with other common drugs. For example, if you combine it with potassium supplements or some types of water pills, you can end up with dangerously high potassium levels in your blood. Even common over-the-counter painkillers like ibuprofen or naproxen can be a problem. They can make Ramipril less effective and even raise the risk of kidney damage. And for people taking lithium, it can cause a toxic buildup. So you really need to tell your doctor everything you're taking.
So, what's the takeaway here for you as the patient? Well, it means your role is super important. You have to be an active participant. That means taking your pill consistently, just like it's prescribed. It means showing up for all your monitoring appointments, to check your blood pressure, your kidneys, your potassium levels. You got to stay hydrated, and you have to promise to report any weird side effects right away, especially that persistent cough or, of course, any kind of swelling. And don't forget about the contraception part we just discussed.
At the end of the day, Ramipril is a really remarkable tool. It's a powerful protector, it's got a long track record of success, but it's a tool that operates under some very strict rules. The key is understanding both sides of the coin, the incredible benefits and the serious warnings. And that all leads to the big question, the one you need to talk about with your doctor: is this the right shield for you?